when you have a question at the end of the speaking order, please use the Zoom function to raise your hand. That would be great. We also ask that you keep your video off just to keep the bandwidth flowing, if that's okay. It just keeps a smoother video experience. Once again, it'll be Josh Jabal who kicks things off. Keep yourselves on mute unless you're asking a question, and we will get things started. Once the question and answer portion begins, we'll try our best to get to as many questions as we can, time permitting. All right, and with all that being said, Commissioner Jabal, you can kick things off.
Okay, well, good morning, everybody. Thank you for joining. Very excited to be joined by my colleagues here, Commissioner Russell Tucker, Commissioner Giussani, and of course, Governor Lamont, to provide an update on schools, which is such an important topic for all of us, particularly all of us who are parents, but really everyone across the state. A year and a half ago, under the governor's direction and leadership, Connecticut really led in terms of getting our schools open and keeping them open and really maximizing the number of days and the amount of time that our students could spend in class, which subsequently has been shown through numerous studies to be so critically important to children's development, particularly of Black and Hispanic children, high poverty schools, and the impacts of some districts that have not been able to keep their schools open and how the significant disruptions that's caused both for children and for those communities. And so today, despite the unprecedented spread of the Omicron variant that we're experiencing, we're still more committed than ever to keeping our schools open. We are going to talk a little bit here about the things that we're doing along those lines. One of the top topics is the acute shortage of testing that exists in Connecticut and really across the country right now. And we've been working hard. We've got over 500,000 additional at-home tests have been distributed over the weekend to our municipalities and are getting out to people's hands. We've got another 620,000 at-home tests that have gone out today directly to our schools and school districts for students and school staff. We've got another 50,000 tests that are going out today to childcare providers. And we received another large delivery overnight. We've got somebody needs to mute, please. We've got another large delivery that came in overnight and millions more tests that are in the procurement pipeline that we expect to receive in the coming days and weeks that we think will bridge us through to when the federal government has signaled that they will be providing a more robust national at-home test distribution plan. And in addition, we've recognized the importance of and the value of having high quality masks available to people, particularly given how transmissible this variant is. And so we've now distributed over 3.2 million N95s statewide and encourage anyone who is wearing a mask, certainly people out on the front lines, to access those if they have not already done so off Amazon or on their own volition to get one of the N95s that we're putting out in cooperation with our municipalities. So we're particularly grateful of the work that was done over the holidays by Commissioner Russell Tucker and Commissioner Giussani and their teams at SDE and DPH, working with our superintendents, working with our labor leaders to digest the latest guidance from the CDC that has come out, as well as the current dynamics on the ground here in Connecticut to make sure that we could reopen schools yesterday. Nearly every one of our schools reopened yesterday safely and effectively. It's going to be a little bumpy, but thanks to their leadership and their guidance and partnership with our local districts, we're very optimistic we're going to have a successful spring semester here. So I'm delighted to turn it over to Commissioner Russell Tucker.
Thank you, Commissioner Jabal, and thanks to you, Governor, and Commissioner Giussani for your leadership as we work together to maintain, as was just stated, in-person learning in as safe a manner as possible. To our superintendents and our teachers and school staff or school nurses, local health directors watching us today, I want to share my profound thank you for all your efforts to keep our schools opening safely for in-person learning. We know the task is monumental, and you're truly doing an amazing job on behalf of all our students and families. And to our families, I do want you to know we hear you, your safety concerns, as well as your commitment to keeping your children in school, given the disruption to their education as a result of the pandemic. Be assured, as was stated here at the Department of Education and with all our agency partners across Governor Lamont's administration, that we're actively working to maintain access to safe, healthy, and enriching environments for a student. It truly is, and some of you have heard me talk about, a best-in-class collaboration that is leading us through this pandemic. And I'm proud of our teams, that our state agency teams that are supporting all this effort, and as was mentioned, worked over the holiday to make sure that we could get guidance out. And also it's for public schools, but also independent and private schools. So as we continue forward, we're committed to this effort. Not only did we learn from our own assessments in Connecticut last year that in-person learning is where our students learn best, but we also know that schools provide critical supports, mental health supports, social emotional supports, nutrition, physical activity, and these supports have grown even more important during this time and the challenges of the pandemic. So unfortunately, we know from our own experience, but also through the negative impacts of COVID on our youth mental health, and it's such a challenge that's faced nationally, as cited by our US Surgeon General. And so this is why last week, again, we worked so hard to make sure around the clock that we can revise and disseminate our health guidance, safety guidance, and as Josh mentioned, organize the distribution of our test kits and masks and communicate with all our stakeholders. So saying to everyone, whether it's masking up when indoors, having a discussion with your child about the safety protocols in school, or monitoring your own symptoms and that of your children, we're all in this together. And I'm confident, very confident that with this team, we're going to get through this together if we all do our part. So with that, let me introduce Commissioner Jethani to talk about our health guidance.
Thank you very much, Commissioner Russell Tucker, Commissioner Jabal, and it is an honor to be in this administration of Governor Lamont. This team has worked tirelessly over the last holiday break to be able to understand the new CDC guidelines and figure out a way to really implement them in a way that can keep our schools open and our children safe. We had guidance that was present before. Schools that choose to continue to follow that guidance have that option to do that. However, we provided an alternative to be able to have schools refocus their efforts on the things that are the best practices in terms of infection prevention, particularly in a time when there is high prevalence of COVID-19 in our community. And so what I mean by that are some overarching principles, which is that based on what we've learned so far in these last 2 years, we know that schools can implement many infection control procedures well, with masks in place, putting some distance, hand hygiene, so that we are asking our school nurses no longer to be focused on contact tracing within the schools. This does not mean we have stopped efforts across the board in our communities in terms of educating our public. However, now we can focus more on those practices within school that we know keep students and staff safe. So with that in mind, the basic premise is that if you are a fully vaccinated child, you continue to monitor for symptoms, even if you've had an exposure outside of the classroom, and you continue to come to school and you remain masked. If you're an unvaccinated child and you've had a significant exposure outside of the classroom, so exposures in the classroom I'll get to in a minute, but outside of the classroom, if you're unvaccinated or partially vaccinated, those students have to stay home for 5 days and quarantine, and then come back to school after that with wearing a mask. If there are cases that occur in a classroom, parents need to be notified by the school district that there have been cases, so that you know, even though we're not doing contact tracing specifically to figure out whether your child was within 6 feet of another child, rather what we're doing is letting classrooms know that somebody in that classroom has had COVID-19. And with these overarching simple principles, that if you're sick, stay home, get tested. If you have COVID-19, you at least know that you must stay there for at least 5 days. If you don't, you can return sooner if your symptoms have resolved and you are fever-free. With these simple principles of following the guidance of symptoms, we believe we can keep as many kids in school as possible while still maintaining a safe environment for schools to stay open. And with that, I'd like to now turn to Governor Lamont.
All right, well, thanks, Manisha and Josh and Charlene. I mean, we're working with you, trying to do everything we can to keep our schools open safely. Josh pointed out, it was a year and a half ago that Connecticut got its schools open, some of the earliest to do that. We did it with masks. We were able to make sure that even in the midst of a very high infection rate a year and a half ago, our classrooms were some of the more safe places to be. And that made a difference. I looked at other states and no masks, and I saw quarantines and kids being sent home. And we avoided most of that because we were careful. And I am leading with care and public safety and public health when it comes to keeping our schools open now. This is a little different than it was a year and a half ago. To be blunt, we have a higher infection rate. We're at probably 24% today. And you may say, oh my God, what's going on? At the same time, it's much less virulent. So there's some transitions there. But the most important difference between now and then is we have even more tools to keep ourselves safe. And that's why, number one, we prioritized early on all of our educators, teachers, paras, those that work at the schools, those that work at daycare, prioritize them in terms of a vaccination. They've almost all been double vaxxed, and the vast majority have also had their booster, doing everything we can to make sure our educators know they can get back into the school, back safely going forward. Same is true now. We have vaccinations for kids. And, the vast majority of the older kids have got their vaccination. Younger kids, not as much yet. It's just been opening up. And look, I understand the caution. I understand it's a kid. I understand people want to err on the side of hesitancy a little bit, but we've had millions of tests over now, close to a year, including the testing. So I'd urge other parents to reach out to your fellow parents in that 5th grade classroom and say, my kid was vaccinated. I feel a lot safer knowing he or she is vaccinated. And I urge you to do the same thing for your child. It's one more way that we can keep our schools safe and keep our schools open. Obviously, we started with masking a year and a half ago. As you just heard, we've got millions of masks in stockpile, N95, the top quality medical masks available. They really only work for adults because that's how they're fitted. But this we're getting out to do everything we can to make sure that all of our educators can stay safe. If there is an exposure, when you come back, you can wear the mask and get back to work in 5 days as a teacher, not the 10 days. And I think that's incredibly important. And I think these masks are going to be widely available, not only for schools, but what they mean in terms of keeping our businesses and our stores and our restaurants open. We've had a lot of talk about testing. Look, I was hoping we were going to get these rapid tests for you, 4 days ago, but they're there now. And we've had, 1 million tests delivered or being delivered as we speak, going right to our schools. And what that means is, look, if, first of all, if you have a child that is displaying flu symptoms, you're not sure if it's flu or what, stay home. And frankly, in this day and age, it probably is COVID. But that said, if there's some symptomatic going on in a classroom, we can notify the parents, get them home, get a test for them so you know that you can get back to school safely. I want all of our teachers and paras and educators to know we've got tests to do the same thing as well. I say more broadly for the population, we don't have enough tests for everybody to get tested every day. But I want you to know that, look, if there's symptoms, you probably ought to stay home regardless. Test after a few days, 5 days, so you can get back to school or get back in the game. For students who have been vaccinated, if there was an exposure, they can get back as long as they're not showing symptoms at all. I just leave you with a thought. I think there's nothing more important for our state and for our kids than doing everything we can to keep them in the classroom safely. I got a big shout out to our teachers and educators stepping up, getting back into the classroom. I know it's complicated. I appreciate the school bus drivers, some anxiety there. I know the parents, some of them saying, maybe not now, maybe I'll hold off. But I'm really proud of the fact that the vast majority of our schools are open and doing everything they can to keep them open. I know that that's in the best interest of the kids. We did pretty well when it came to telelearning last time around, but we also learned the hard way that learning via Zoom is not nearly what it should be when it comes to keeping your kids in the classroom with their peers, with their friends, with a teacher that loves them in this day and age. So that is why we're working hard to keep your kids in school, and that allows more of our families to get back about their daily lives as well. With that, I'm happy to take any questions.
Once again, we're going to ask individuals to use the hand raise function. Already see several of them. We'll start with Seamus McAvoy from the Hartford Courant.
Thank you, Max, and thank you all for being here today. I wanted to ask, first of all, with staff absentee rates, maybe that's information that Commissioner Russell Tucker may have among school staff. Just looking at some other communities, neighbors to the north in Boston Public Schools, they had about more than 1,000 staff members, many of which were teachers out today. Is that information available either for today or for yesterday coming back from break?
So thank you for your question. So we don't have the specific numbers of staff outages available to us. We've been checking in with our districts, and they have shared in general for those that were not opened yesterday or those that are not open today, that it really is a combination of staffing outages and including bus drivers. The governor mentioned that, but I don't have a specific number.
Thank you, Commissioner. And I wanted to ask for Governor Lamont as well. Yesterday, some union leaders between AFT Connecticut, Connecticut Education Association, et cetera, they're calling on some tighter protocols, safety protocols in schools. They also want to keep schools open, but they want to make sure that they stay safe. And we know schools have traditionally been a safe place to be, thankfully. Even so, they would like to see more temperature screening outside of schools, which can help pick up symptoms, say in nonverbal students as well as others. They'd like to see N95 masks be mandated inside schools, maybe if not among children, then among staff members, the adults that the masks are fitted for, as well as testing being available on site and vaccinations being available on site. Have you seen those demands, and are there any of those that you support, don't support, any more protocols that you're considering as we see cases rise? I think you mentioned 24% today for daily positivity rate. Your response to those demands?
Yeah, hats off to the teachers. And I'm in regular contact with them, and Charlene's in hourly contact with the leaders. And these are good ideas. Look, the temperature check, we had that going before. We had hundreds of thousands of thermometers. I'll rely on Charlene. It's up to the schools if they want to keep that going. I think it makes all the sense in the world. I mentioned that the N95 masks, my understanding is they're not sized for kids. So it doesn't work to mandate that medical quality mask for them. But I think we're finding that the mask that the kids are wearing is making an enormous difference. And my intention, looking at the infection rates right now, is to keep those mask mandate in place, probably through the end of my executive powers. The testing, I think, is on an as-needed basis, and I think we're going to roll that out. Testing is best done, send it home, and the tests are done at home. Vaccinations, first, tests are done at home. Tests are done with a parental insight and permission. I think that's probably the best way to do it, probably the law, by the way. And the other one was, vaccinations. Again, that can only be done with parental permission. So would have to coordinate that to make sure the vaccines are done accordingly. But anything to add there, guys?
I'll just add a few things there, which is that we've been working very closely with our schools to be able to provide clinics and our mobile vans who've provided vaccine clinics at schools. And in addition, I think that we've seen that the mask wearing so far that's been there has made significant differences already. So with even better masks that are available to teachers, that can only help further.
And I'll also add, or just to reiterate what Commissioner Jethani had mentioned previously, that with the shift in contact tracing, that it really is allowing us to make sure our health staff in our schools are able to work towards in-school to address the risk for in-school exposures. And they're looking at identification, early isolation, and clinical management of our students and staff with active symptoms in schools. So that is allowing us to really get close to your question of more safety protocols in our schools. I think we're on our way there with some of these changes that were just made.
I just want to add one other thing as well that I forgot to mention, which is Project COVID Detect, which was weekly testing, has been available to all schools for many, many weeks now. So that's already been something that's been available to schools who've opted to join into that.
Great, thank you all.
We'll go next to ezymaris.
Good morning, everyone, and thank you for holding this update today. I know that we've been talking about prioritizing those vulnerable populations, and obviously you mentioned that that includes getting tests to students and staff. How is that being distributed? How does that process work? And obviously this is going to be an ongoing battle and challenge. So how are you going to keep those tests, getting them into the hands of students as the pandemic continues, as these numbers continue to be high, and as students are in the classroom?
One of you guys want to take that?
Sure, I'll get us started. So as we mentioned earlier, we started distributing at-home tests on Friday last week. Some municipalities used their allocations to help prioritize some for their schools. But in any event, every district is able to pick up today their additional allocation as part of that 620,000 I mentioned earlier. And then they will work with their local resources, their local infrastructure, and their local processes to distribute those tests according to what's best in that school district. As you allude, we are continuing to procure more. We're anticipating the high demand will continue for a bit longer. We do have 400 testing sites, as well as Project Detect that Commissioner Jethani just mentioned available, but we still want to continue to provide a more steady stream of rapid tests to help meet this near-term surge, particularly until the federal resources become available. So we're continuing to plan and procure accordingly. Anyone want to add to that?
I'll just add, Josh, and for everyone here, that we're focused on our public schools, but also our private and independent schools. So they're a part of that distribution and delivery pickup today as well.
We'll go next to Christine Stewart.
Thanks, Max. So schools are delaying and canceling or simply don't have bus service due to teachers being absent, lack of bus drivers. I mean, what can be done about that? Are you going to ever consider going remote again or shortening the 180-day school year?
Charlene?
Christine, thank you for your question. And we're really working and monitoring this closely with our superintendents. I know some of them have looked at, in some cases, it might have been a school that was not able to open. In some cases, the districts, they're working very hard and planning. In some cases, they're looking at a professional learning day that they are reducing, or a district said we'll make this up at the end of the year. And so they're being really thoughtful and strategic about how to do this. We, again, recognize the challenges, and we'll continue to help problem solve with them. Staff were on the phone yesterday with some of our districts, trying to work through with them on this. Again, because our goal, as we've stated, is really to keep kids in school. We're all agreed on the disruptions and the learning challenges that they've had. And so we're looking for, really, it's more time and not less time in school for their instructional needs. And so we continue to work that through, and we'll continue to address this as we move forward.
And Governor, at this rate, COVID is going to have an impact on the economy. What type of tax relief are you open to? Are you open to anything other than tax relief besides tax credits like the property tax credit or the child tax credit?
Yeah, Christine, I think fortunately, when it comes to rent relief and utility relief, we still have a lot of capacity there to make sure that despite this second surge or fourth surge, we can keep people in their homes and keep them up to date in terms of utility. I think that's extraordinarily important. We've expanded the scope of healthcare dramatically, thanks in part to some subsidies from the federal government to make sure the healthcare and health insurance is more widely available, and making sure that nobody is denied going forward. You know, I'm making sure that our testing, making sure that vaccinations are all available regardless of cost. No cost to anybody at all, no questions asked. Make sure that that is universally available. In terms of, other tax things, as you probably know, we just dramatically increased the earned income tax credit. So that's the biggest tax cut for working families the state has seen in an awful long time. I want to make sure that we reward work and people have a good, strong incentive to get back to work. Number one, public health, that you can get back to work safely. And two, that work pays, you keep more of your paycheck. Those are some of our priorities.
We'll go next to Paul Hughes.
Thanks. Has there been any thought or any discussions, planning regarding using National Guard troops to serve as substitute bus drivers? And in Waterbury today, or yesterday, 45 drivers missed work.
Want to take that, Josh?
Sure. Thanks for the question, Paul. It's a fair one, although, there are certain, commercial driver's license requirements and other requirements to be able to drive school buses that we've looked at this in the past, and we don't have resources in the Guard that can support that mission. I would point out, though, that the Guard is extremely active as we speak. Over 200 Guardsmen and women who are on active duty, helping to support testing and mask distribution, helping to augment the staff at testing sites around the state where the volume is high, or where a testing site may have lost staff due to a staff member getting sick. So the Guard is fully engaged, and General Yvonne and his team are continuously jumping in to help with whatever the new challenges are.
Has there been any thought given to opening up, say, mass vaccination sites again for, say, boosters?
We have over 1,000 sites around the state right now that are doing vaccinations, and we are continuing to monitor that very closely. At this point, we don't see the overflow demand like we're seeing for testing right now. So we're focusing really our efforts on scaling up testing capacity. From a vaccination perspective, we've been encouraged to see some uptick in boosters coming through. I think many people are following this closely enough to see that the evidence is mounting that having that booster makes a huge difference right now about either not getting Omicron to begin with, or if you do get it, reducing it to a common cold as opposed to something that could require hospitalization. So we still have a lot of people in the state who haven't gotten their booster. It's a critical message going out is to go get your booster if you haven't yet. There are 1,000 places around the state where you can do that. And we haven't heard a lot of reports of huge lines or over demand there.
And Governor, back to that tax relief question real quick. What about your property tax credit? I know you had a proposal, you campaigned on a proposal. Is that likely to be part of your budget recommendations in February?
Yes, it's very likely. I'm going to try again. I think it's the right thing to do. I think the property tax hits the middle class really hard. And we're going to get property tax relief through this next session. Along the way, Paul, with a lot of federal resources and additional state resources going to our municipalities, that's also allowed them to hold down their property tax or even reduce it a bit locally as well.
Okay, and one more question for you, Governor, and then I'm done. It seems pretty clear, the message coming from you, your education commissioner, and even your public health commissioner is we're not going back to remote learning. Is that correct?
That's correct. I'm going to do everything I can to keep kids in the classroom safely. There's nothing compares to a great teacher in a classroom.
Okay, thank you much.
We'll go next to the Valley Independent.
Hey, I'm Eugene Driscoll of the Valley Indy. 2 questions, maybe 3. First, on behalf of a CT News junkie, are you going to go back to mass testing sites? And then my question specifically is about local control. Some of the school districts have been sending home communications to parents saying basically, well, we can't go remote because of the governor or because of the state. But I'm also told, no, the school districts, if they wanted to or had to, could go remote, that it is an option, but whether or not it counts towards the 180-day requirement is what's up in the air. Can anybody provide clarification there?
Charlene?
So Eugene, we've provided guidance that really allows provided information to districts about remote learning and what counts and what does not count. And so as a regular school day. So towards that front, students who are confirmed COVID or in quarantine, districts can certainly do that. That counts. Those residing with vulnerable family members, that they could certainly do, or students with disabilities, where there's an agreed upon remote instruction for their programming, that would certainly count. And so those are the situation and circumstances, and if there were certainly an emergency declaration in that case. So districts can make local decisions as they do on a snow day. However, right, they then would have to make up that day. So we provide that clarification for our districts.
And I'm just wondering, one follow-up, like locally we had Ansonia closed for the rest of the week. Might be an imaginary scenario, but let's say the BOE here said, we're going to go remote. Could they do that?
They could certainly do that. However, their decision to close, and as the superintendent Ansonia said, that they're making up those days. So if they decide for the continuation of learning that they want to do that, however, it's not one of those exceptions for counting it as the 180 days. So in Ansonia, I think they're making it up at the end of the year.
Right. And from what I understand, if they did go remote, they would have to, there's a way those could be counted toward the 180-day rule if there was a special session and the legislature said, yeah, you can do that.
If the
legislature totally barred.
Yeah. If the legislature, came in and made some changes on remote learning, they can certainly do that. Right now, it is not permitted.
Okay, thank you.
Go next to Caitlin Burchill, NBC Connecticut.
Hey guys. So following up on the scaling up testing capacity, not sure if this is Josh or the governor, but looking, I was in New Britain yesterday, 5+ hours, people are sick. They needed a PCR to go back to work because they had some kind of symptom. Are we going to scale up?
Yes, so the teams are working to scale up testing, have been for the last several weeks. We see the lines, we hear the frustration. We see it across our neighboring states. Like we are very focused on this. In addition, as mentioned, getting the at-home tests broadly distributed to people will help take some pressure off that. We think the holiday season behind us will help take some pressure off that. But yes, we are very, very focused on that. As I mentioned, we've been deploying the National Guard. We've been drawing on the vendors that we have on contract to do more testing, to expand the hours, to add new sites. So absolutely, area of focus.
Josh, just following up, would you say to businesses that maybe not need a PCR test? I think that's one of the big issues right now. You're handing out these at-home tests, but they're not viable for businesses to get back to work.
Yeah, Commissioner Giuttani, do you want to talk about the return to work and CDC guidance?
Yeah, so I think a couple of things I would mention is that in the current guidance that exists from the CDC, if you have tested positive, after 5 days, you can come out of isolation and continue to wear a mask and can return to daily life. So for employers, you can consider that guidance. I would also say that in many different sectors, we have paused sort of PCR testing requirement and have been using self-testing. And so other businesses could consider that if they are using testing as part of their strategy of keeping their workplace safe, is to be able to use self-tests as well. But I think the main thing to consider is that if you've had COVID or if you've had any respiratory virus and you are better and symptom-free and you are beyond 5 days and you continue to wear a mask, you should be able to safely re-engage in society with the CDC guidance the way we currently have it.
Much appreciated. And one last question, Josh, this might be for you, but the state, we've learned, has ended their Yale wastewater contract. That doctor or the person over that program said, if we were doing that, the DPH numbers are way underreported. We would have a much more broad case of COVID cases in Connecticut. Why did we end that? And would we consider doing it again?
Yeah, thanks for the question. I mean, we discussed that, I think, last summer, and having looked back over a year plus of data, we think that, the conclusion was that surveillance wasn't providing us a lot of additional insight that was actionable that we weren't already getting through other means. So it was really interesting, and it was, helpful in those early days. I don't think we need more data right now to know that community transmission is pervasive in Connecticut. I don't know that it would tell us anything we don't already know or that we want to do differently as a result. So, we have very robust, hundreds of thousands of test results coming in every week, all the at-home testing going on. So it was a great project, and we really appreciate that partnership with Yale. It was very, very interesting at the time.
Thank you.
Go next to McCaron, Fox 61.
Thanks, Max. Hi, everybody. Just a few classroom safety related questions for you all. I don't think many people would disagree, like you were saying, that in-person learning is best. But as I've been talking with teachers, one thing that I've heard from them is that in addition to a lot of staff being out on a daily basis, they have a good portion of their students that are out. And they're saying that because of that, even though they're in person, they're not able to really teach any new material because they don't want half the class to be left behind. So essentially, it's almost like a daycare. And they say that in a lot of cases, they could be more productive in a virtual environment. Could someone speak to that?
So Matt, I'll just share that, we talked to our union colleagues as well and our educators, and that, that fair point, which is one of the reasons I think even today we're saying we're messaging to families as well, to really work closely with the districts to know what the mitigation strategies are, to really be comfortable in making sure, knowing that the school is doing its level best to keep them safe in school, because that truly matters. And we still have families who are concerned about devices and connectivity for remote instruction happening. And we have educators as well who are concerned about having to do remote and in-person hybrid learning. And we all agree that in-person is best. So I think what we're working on here is to make sure our educators have the strategies that they're employing and the supplies that they need there, and for families to understand how much effort has been made to make sure that classroom is really a safer place for them, and they can really develop that confidence that everyone's working very hard to keep their kids safe.
Yeah, but could you just speak specifically to the lack of, advancement of instructional content during the day when half of the class is out? How can you really advance the curriculum?
Yeah, and again, really important to work that through, and we hear you and understand that. And certainly we'll continue to work with our educators in that space. I understand clearly, right? You don't want to leave many kids behind, again, which is why we really want them there in the classroom, and really having our families have that confidence that they can come back in.
All right, thanks, Commissioner. One more for you. one more for you. I have been hearing also from teachers that, for example, in the elementary level, breakfast needs to be sometimes done in the classroom, snack in the classroom, not in a cafeteria where you can space out and distance. So, the mask is off during that time, and what was 6 feet of social distance turned into 3. Teachers are telling me it's more like a foot or less. So during snack and breakfast, are those, how do you do that safely?
Commissioner Juthani may want to add something else here, but Matt, we've also been providing a lot of guidance around what to do because we know nutrition is so important. We want our kids to make sure that they have the nutrition that they need and how they can do some of this safely in classroom, using other extra space that they have. And we'll continue to provide that support. We have staff members really ready and able to provide individual guidance and support as is needed in that vein. It is important. Nutrition is really important for learning.
For Commissioner Juthani, I heard you guys talk a little earlier about or N95 masks not being fitted properly for younger children, but there are like KF94 masks, which are the Korean standard of an N95. Is the state considering procuring a better, more high quality mask for younger children?
Well, what I would say to start is that some type of mask is what is most important. And what we've seen is that so far through this pandemic, our kids have been able to be safe with the masks that they have been wearing, which are a variety of them. And certainly parents can explore whether that type of mask is something their children would wear. I think what is really important is that children wear some type of mask. We can get into the nuance of all the different types of masks. And we have plenty of people who have concerns about their children wearing masks, period. So I think what we need to remember is wearing a mask is what is going to be most protective, and actually wearing it, not having it be on the chin or somewhere else. And so to your point about classrooms, I think if people are eating in the classroom, they spread out as much as they can. And when they're done putting something in their mouth, they cover themselves back up with a mask. Kids are good at that, actually. They kind of know how to do that. These are simple things that children can do to help maintain safety even in the classroom.
Thanks, everybody.
We have time for about 1 or 2 more. We'll start with Adria Watson from the Connecticut Mirror.
Thanks, Max. I have a couple of questions for Commissioner Russell Tucker. Does the department collect and have the number for how many districts closed schools or delayed start days yesterday or this week heading back from the holiday break?
Hi, Adria. We have some information from yesterday and today so far, and I know Eric Yazani can share that with you.
Thanks. Oh, thought that was going to get shared now. Sorry. And I know the question was asked earlier about staff absentee rates. Do you also have any student absentee numbers from yesterday or today?
No, we don't have that information here. That lags for us here at the department in terms of having the attendance information.
Okay, thank you.
Julia Werth, CT Examiner.
Sorry, it said I was muted. So I have a question about the change in policy for vaccinated versus unvaccinated students when they're exposed outside of school. You said that, if a vaccinated student's exposed outside, they don't have to change anything, but the vaccinated, or reverse, but the unvaccinated do not. With vaccinated people spreading it and getting it as well, why is there a difference there?
What we know so far is that although it is true that vaccinated people have been able to get infected, when you weigh all the different risks and the mitigation strategies that we do have in classrooms, which primarily is masks, the fact that everybody in schools are masking, we made the decision that for a child to lose 5 days of school, which would be moving backwards from where we were in terms of where children were coming to school if vaccinated despite exposure, we overall weighed the risk benefit to say that the risk of developing COVID was small enough in a vaccinated person and the benefits of being in school were important enough that unless somebody was to develop symptoms, they should be able to continue coming to school, of course, while still wearing a mask though.
Okay, and then just to follow up, you've said a few times that, any mask is better than no mask for the student. Do you have like data specifically on that in the schools in Connecticut, or is that from other studies from the CDC?
Well, we have our information that we've seen in these last 18 months that students have been coming to school and looking at the information that schools have shared with us in terms of rates of COVID transmission within schools. It's not zero, but it is low overall, given children wearing masks throughout this pandemic while people have been in schools. So using that, we've been able to extrapolate and sort of continue with our guidance the way we've outlined it.
But no specific like masks are doing this versus not wearing masks are doing something else.
Well, we have published data from many school districts throughout the country that the CDC has published, regional school districts have published. For example, in North Carolina, there was a publication in pediatrics from earlier this summer that showed that with masks, there was very low transmission between people. So I think that it is that type of data that we have used along with what we've seen from our school districts here in Connecticut.
Okay, thank you.
John Craven, News 12.
Hi, everybody. So these kids who have to test either because, after 5 days, either because they tested positive or they had an exposure, are they going to have to submit those test results to the school district to come back? Otherwise, how do you enforce that?
So, John, there were, I think, two things put together there. The first was if you are symptomatic and you test positive, you would just report that to your school nurse the way you normally would. For those kids who have been identified as a contact, an out of school contact, and they do a test at day 5, we're using an honor system for that. So they will notify their school, but having said that, they will not be submitting those specific results unless the school chooses to. So we have not mandated that as part of our guidance. But if a school chooses to do that, they certainly are entitled to do that.
Okay. Given what we've seen with the effectiveness of boosters versus just 1 or 2 shots, are you guys reconsidering at all redefining fully vaccinated to mean with a booster?
So I think the CDC has not specifically made that distinction. I think where we see them moving is sort of the definition of up to date with your vaccination series. We wait to see what they say. I think it is explicitly clear, though, for everybody to know 3 shots is what you need to be protected from COVID-19. So regardless of what definitions are out there, get your booster, you need 3 shots.
All right, and just one last question. This could be for any of you. Given all the staff shortages, school districts closing, delaying because they don't have enough bus drivers, because they don't have enough teachers. Is there anything else the state can do to try to get more staff in, even on a temporary basis? I know you talked about the National Guard isn't really an option, but are there any other things we can do on a short-term basis?
So, John, I can share with you that, I had staff even check in with the organization that placed substitutes in classrooms, continuing to work on that. They right now seem to be doing okay with being able to provide, substitutes for the schools that are in contract with them. And so we're continuing to work to see how we can make sure there really is a robust pool of substitutes that can be called upon. So we continue to look at what it is that we can do to help support around the staffing challenges.
Catherine Shen.
Hey everyone, just a quick follow-up on everyone else's remote learning questions. I know you mentioned, Commissioner Russell Tucker, that there are specific elements that you have to meet in order to have that as an option. But what about school districts who cannot provide the remote learning option for families who need them? Are there options for them to be able to continue their education today, if that's the case? And on a related question that's probably for Governor Lamont, there are a lot of educators and staff who are testing positive and families are concerned of them returning in person. So will you consider a more robust vaccine mandate in the future?
So just to clarify, I would say school districts are working really hard to make sure that families, I don't know if you're talking about families who are immunocompromised, to make sure that they can provide learning for those students, while at the same time trying to make sure that families understand what strategies they have in place. One district I know, had the family even come in to see exactly where the student would be seated in the classroom to try to, develop confidence in that front. So I know it's a challenge, but our districts are really continuing to work hard to address those needs.
And Catherine, to your rest of the question as regards vaccine, look, clearly the third shot and the booster is necessary to keep you the safest possible. We've been trying to do that as much as we can through encouragement. We have one of the highest percentages of folks who have gotten the booster, but it's not universal. And so we are taking a look in some situations where we can work together to make sure we get 100% participation when it comes to the boosters. But let me give us a little time as we work through on that.
Thank you so much.
Final question, Cayla Bamberger.
Hi, thanks all for convening today. I'm looking for some more clarity about how symptom monitoring as opposed to contact tracing will work in practice. For example, one of the protocols the Union Coalition raised yesterday was outdoor temperature checks, basically screening students for a fever for those symptoms. Is that something the state would consider requiring or recommending?
Maybe I'll start with that question. We did a lot of temperature checks in the early wave of this pandemic. And I think overall, we know that although fever is certainly one indicator, these outdoor screening checks where these thermometers may not function optimally and also create a lot of backlog in terms of students being able to get into the school is certainly problematic. Having said that, if a school were to choose to tell parents that they want to have them screen their children every day, that would be up to them. I think that there are a bunch of symptoms that really can go with COVID-19, and we are asking people to be very vigilant about any symptoms at this point, because quite frankly, when you have this amount of prevalence of disease in a community, although there are other viruses circulating right now as well, we know that if something walks like a duck and looks like a duck, it's probably a duck. So, if you have cold symptoms, stay home. That's really the safest thing, and get tested.
And I'll also add that working directly with our school health staff, we have access and meet with our school nurses and our school medical advisors. And this issue of infection control and the change is something that's a priority for us. So maybe in the next couple of days, we'll be meeting with our school nurses to really talk about what implementation looks like at the district level and how we can support. Some districts have hired additional health staff using some of their ARPA dollars, districts that have hired more LPNs to support the RNs. And so we're going to be meeting with them to see what additional supports they need. It is a critical part of what we need now to make sure our schools can stay open. Our families can feel comfortable having the kids back in. Our staff can feel comfortable teaching in a safe environment. And so that truly is a priority as we go forward in the very near term.
Thank you.
Hey, Max, it looks like we may be wrapping up. I just wanted to say a couple of things. Matt Caron's question had me, thinking about the fact that our schools are open. I think we're got our schools open safely, but there's still some kids now who are not coming into the classroom, and how that makes teaching complicated, especially new material. A year and a half ago, we opened our schools. They were open safely, but we didn't have, a third to half of our kids coming in. And you have to build confidence every day to give teachers, give parents, the confidence that we're doing everything we can to make sure your school can open safely. And you can see, I think, by this group today that we're making that our #1 priority. And I think we can succeed. I say that more broadly about our economy. If you're a store owner, you're a restaurant, it's not simply a matter of opening up. It's a matter of giving your customers, your employees, the confidence that you're doing everything you can to keep them safe. And that many times means wearing the mask indoors. Really good idea. That many times means showing that you've been vaccinated before you go into that restaurant. Give people that confidence that they can keep going about their daily lives. And I know 24% infection, oh my gosh. But I think we have the tools now to continue living our life despite COVID. And I think we can continue living our life safely. And that's what we tried to demonstrate today when it comes to our schools. And I know the anxiety. Somebody mentioned one of the questions, long wait line to get the PCR test in New Britain. I was talking to folks along the way there. And I saw the anguish in some people, the resignation in some people, a little anger in some people, but mainly a sense that we were the most vaccinated state in the country. How can this happen here in Connecticut? And I just want you to know that the vaccinations and the boosters are making an enormous difference. We have a high infection rate. We're holding the line on our hospitalizations, in particular the ICUs, where we need capacity there. What a difference that makes. It's still 10% of the people, those unvaccinated, that create 70% of the load in our hospitals. And if I could get that 10% vaccinated, we wouldn't have that as an issue. I've got to say, finally, I used to be a little dismissive of infection rates as not a leading indicator, and I was more concerned about hospitalizations since that was a demark for us. I pay a lot more attention to it now because of workforce. And I see the stress we're going through. We obviously know about bus drivers and teachers, but in restaurants, manufacturing, doing what we can to get people back to work. And that's why I think the testing is important, making that more widely available, making sure at the end of that 5 days, you can get back to work and get back to work safely. But if I have a message for you, it's 24% infection rate is lousy, and it may get worse before it gets better. But we have the tools in place, provided you take advantage of the tools, the masks, the vaccinations, and then the testing. We have the tools to keep you safe and keep going about our lives. And I hope that was part of the message you got today. Thanks so much, everybody. Appreciate your time.